We can decrease those numbers because that decreases less plaque buildup in your heart, less plaque buildup in your legs, and over time, you're not going to have a heart attack, you're not going to have vascular occlusive disease, things like that.
This is cutting edge longevity science that we are going to use to keep forever young. And it's called Therapeutic Plasma Exchange. And this particular topic, it's this intersection between modern medicine and anti-aging.
And something that's been around for a long time that we've used, and hospitals have them and everything. But now,
besides treating diseases, now we're looking at it from an anti-aging and longevity perspective. So Therapeutic Plasma Exchange, or TPE, what we'll do today is kind of describe, first of all, what is it? Who's a candidate? What biomarkers or what blood values are we looking to correct? What diseases can be treated? And maybe we touch on some of the newer research showing its anti-aging benefits. And I'll start the entire conversation by saying that many of you have probably heard of that heterotopic parabiosis study where ultimately the young mouse was sutured to the older mouse. The older mouse started getting younger. And the original thought process was, all right, we're replacing older plasma or older blood with younger. And it's much more complicated than that, but we're finding out new things. So first of all, what is TPE?
So there's also another name for it called plasmapheresis. TPE is basically coming in and filtering, or in a very simple way, giving you an oil change, okay? Filtering the liquid component of your blood, which is called plasma, which really holds a lot of the senescent cells or the dying cells or the inflammatory cells in the body that cause disease.
Yeah, it carries a lot of cytokines, interleukins, tumor necrosis factor, and some autoimmune complexes, some protein complexes that become toxic as we age and contribute to aging itself.
Absolutely.
And so the idea is you're putting your blood through this filter and then replacing the body with...
And if you've ever given blood, and I do that every quarter, if you've given blood, it's very similar to that, but this requires 2 IVs. Sometimes you could do with 1, but 2 IVs, anywhere between 2 to 4 hours, depending on how big of a person you are and your body volume. And it just basically takes out your blood and puts the blood back in, but takes the plasma out. And again, when we're talking about that plasma, that liquid component, that yellowish kind of, transparent in a sense looking, it's not bloody, it's not red. It doesn't have the red blood cells, the white blood cells. It is the liquid component. But we don't just get rid of it. Yes, we do, but we actually replace it with albumin. And albumin is very similar to plasma. It is volume that will be replaced, but we also add a few other things.
Yeah, look, I mean, this was all the rave when you'd watch Silicon Valley and they talk about having a blood boy, and the original thought was that you're going to remove some of the old blood and replace it with new. Well, the problem is your body mounts an immune response, and so that's not necessarily the correct way of doing things.
I've been trying to do that with his blood for years.
The Brian Johnsons of the world who, he uses his son's plasma. I think he started off doing that. The idea is that in order to avoid some pretty serious reactions that you can have with your immune system, we replace it with something called 5% albumin. Albumin is a protein that we have in our body, but imagine that now again, for myself, let's say we have anywhere from 4 to 5 liters of circulating blood volume. The blood comes out from one IV in through the machine, goes through a special filter. All of those toxins are pulled out. All of the plasma is pulled out. And you can remove anywhere from 2 to 2.5 liters of plasma. Now, obviously, your body can't handle that type of volume loss and would go into, definite fight or flight mode, if not sort of leaning towards shock. So we replace it with this liquid protein called albumin, and it's essentially like giving you brand new oil. And so
it's very similar to plasma. So that's why it's like we're kind of replacing like for like, instead of just filling you up with just saline or ringers, which is just regular fluid that we give. This is very similar to the constituents of plasma. And it's interesting because, if, for example, at Cedars-Sinai, there's a whole division for apheresis and plasmapheresis that's outside of the blood donor services because it's used for really sick people.
Sure.
It's used for people that have had heart transplants or kidney transplants or liver transplants, or they're going through chemotherapy, and because it really does detox the body. And now, we've been looking for these like easy ways of detoxing. This is actually a way to get rid of bad cells that are circulating through your body that can cause damage over time. Now, I would love to say that this is a one and done type of treatment. It does help. It's fantastic. And we can actually show, and we're going to discuss this in a little bit, that biomarkers that can go down, it can actually reduce cholesterol. It can also reduce other things that we'll talk about, and even in one sitting. However, the way our bodies work is we then circulate more plasma, and that plasma then has more senescent cells, and then we have to continually do this on a yearly basis, sometimes even 2 to 3 times a year to really get the best effects possible.
Yeah, when you look at it from a standpoint, let's say throughout the year, let's say you were to do this once every 3 to 4 months. The idea is the first time you undergo TPE, it will clear about 75% of all those toxins and things that we talked about. The second round would get you up to 85% of the toxins. The third round would get you to 95% of the toxins. And then the fourth would give you closer to 98, 99%. And so that's why repeatedly undergoing plasmapheresis can improve longevity. And let's take a step back. So who's a candidate for these things, right? Is it necessarily that you have to wait until you're 60 years old, or is it something that you can start a little sooner?
Now, our thought process, and now that we are really have dove into this world of longevity, our thought is starting earlier is better. And it's just like, it's interesting. It's just like Botox. Why create the wrinkles? Why have more senescent cells if you can clear them out? Why let your body kind of go down that inflammatory cascade where you can slow it down? So I do think that starting it at an earlier age is better. I would probably say somewhere in your 30s. I think probably earlier than that, maybe overkill, but I don't think it's the beauty of this procedure is it's not harmful. There's nothing harmful about this at all. And I think that it's only beneficial. So I do think that, there's who is traditionally over the years, before it was used for longevity, we'd be using it for things like myasthenia gravis, Guillain-Barré syndrome, multiple sclerosis, thrombocytic purpura, lupus, and the list goes on and on and on. People with really, really bad kidney disease would do this because it really got rid of some of the toxins that would make them feel really bad when they weren't doing dialysis. Because you can't do dialysis for most people every single day because it's difficult.
Going along those lines, those are all diseases that are either autoimmune sort of diseases or they're formed from inflammatory markers or chronic inflammation. And so we call it inflammaging because it's exactly what it is, inflammation leading to aging. And so this is for anyone who suffers from any type of chronic inflammation. I mean, it's one of the hallmarks of aging. And you look, there are literally 9 hallmarks of aging. We look at genotoxicity, we look at mitochondrial dysfunction, and we look at cellular senescence, things like that. But the reason why these things form is because your body can't keep up. They're too busy trying to attack all of the toxins that you are accumulating. And whether it's from our diets, from the environment, what we do to ourselves, and you create all of these toxins that build up over time. The idea is we filter it out and start afresh.
And it's interesting because certain diseases like Alzheimer's and Parkinson's, neurodegenerative disorders, nobody really knows what causes them. Really, they don't. And we're still trying to figure out, why do people get neurodegenerative disorders? One of the reasons I think what most scientists are coming up with is we have high circulating levels of inflammation and senescent cells. These cells need to be cleared out so they don't cause permanent damage.
And the cells actually, and that's going to be another topic that we'll have, really called zombie cells. And that is where we use an NK cell vaccine to destroy all those cells. The great part about TPE is it filters all of the toxins and all the byproducts of these cells in the plasma. Again, cells are recirculated and redistributed to your body, but if you remove all these toxins, your body's going to create a different cascade of biomarkers, right? And so if we look at some of these biomarkers, let's say, what could I look for in my blood if I said, all right, look, I'm going to get some labs before, and then I undergo TPE, and then I do labs after. What should I expect to change?
So now, considering we already do this here in the office, these are things that we order for people. So we order inflammatory biomarkers. So the simplest, the most simple test is something called C-reactive protein. High levels of C-reactive protein show high levels of inflammation. Markers like cytokines, IL-6, tumor necrosis factor A, things like just general lipid panel. So the general lipid panel, what we get is, as we've always, the cholesterol, triglycerides, HDL, LDL. But I think what's even more important nowadays is the lipoprotein. And I think apolipoprotein A, right? Is
ApoE and LPA.
And LPA. Those have been shown now to be more important than even your cholesterol, triglycerides, because they're direct correlation to cardiovascular health. And I think that if, one of the things that we want to really show is that we can decrease those numbers, because that decreases less plaque buildup in your heart, less plaque buildup in your legs. And over time, you're not going to have a heart attack. You're not going to have vascular occlusive disease, things like that.
Imagine metabolic syndrome, which is probably what most of us suffer from as we age. Metabolic syndrome has to do with lipid dysfunction, which is your cholesterol. It has to do with glucose dysregulation, and that's why everybody is on semaglutide and Ozempics and things like that. And it's for the increased incidence of cardiovascular disease. So now this is a particular treatment for metabolic syndrome. The idea is removing some of these toxins and insulin resistance. That's, really something that happens as we age. And once you start losing the ability to metabolize glucose correctly, and you lose that insulin sensitivity. I mean, you have to imagine insulin's responsible for helping build lean muscle, and glucose is responsible. When your glucose levels are so high, your immune function can't take over. That's when the macrophages don't work. And that's usually at a glucose level that's over 200.
Which isn't even that high.
Yeah. So the idea is that when you undergo plasmapheresis or TPE, when we're filtering out all these toxins, you will see a reduction in your LPA and ApoB levels and your LDL levels, your triglycerides. These are other things that obviously, I think now there's more research showing that we want a healthy LDL. But as you had said, the inflammatory portion, it's really the LDL particle size, right? It's not just LDL. Sometimes having a higher LDL isn't necessarily the worst thing. Obviously we want our HDL to be a little higher because it has a protective effect. But again, it's all due to particle size. And that's where using the LPA and ApoB really show us that this can clear out some of these inflammatory causes of lipid dysregulation.
And it's really important to understand that this is something that it's just like anything else that we do. Let's say that we do TPE and we show these really greatly improved numbers in your cholesterol. And this is something we've talked to a lot of the internists in town saying, let's see if we can eliminate the use of medications, because all the medications that you take for cholesterol or for triglycerides or even antihypertensives, any of these things do have detrimental causes to your body. So the key is...
Yeah, I feel like every medicine we take, there's always a side effect.
Always
right?
a side effect. And some people really get bad ones, right?
Yeah, definitely.
And the interesting part is, just like I tell people that I do liposuction on, I said, just because I'm doing liposuction on you doesn't mean you can go out and live a very unhealthy lifestyle and start eating poorly and not exercising. This is the exact same thing. TPE doesn't mean that we do this and then you completely go and just destroy your body. No, you have to maintain that healthy lifestyle. And I think if you do that, this is something that can dramatically lengthen your life and also lead to incredibly better biomarkers and hopefully a decrease in medications and need for intervention from our traditional Western medicine.
The whole idea behind this, obviously, is we're not only looking at increasing lifespan, but health span, right? So when we look at, as we age, we look at the increase in inflammation, cellular senescence, a decrease in the ability to mount an immune response. Eventually, this adds up and that's where we come up with that term that I brought up earlier, inflammaging. And that is the key factor in a decline in function. Again, neurocognitive function as well. I mean, this is where we look at the Alzheimer's, in dementia, things like that, plaques that form in our brain. And I should say we are increasing cognitive function in those patients that have Alzheimer's disease. And so I think this is very promising. When we look at clearing out that aged plasma and replacing it with fresh, clean albumin, it puts the body in this fight or flight mode, which ultimately increases your immune function. Right? Your body builds and mounts this new response, but now it doesn't have to fight against all of the toxins that you've just cleared. So, again, I think that in reducing that inflammatory load, we're improving cellular function, we're boosting immunity, enhancing cognitive function, and promoting skin and soft tissue health. I mean, the idea is, think of all of the aches and pains that are formed over a period of time think of all the chronic pain from joint degeneration and things like that.
It's all inflammation, right?
That's right.
And it's interesting because one recent paper that I read about therapeutic plasma exchange, and you have to understand that as plastic surgeons, this is something that we're directly interested in because we really want to make people live as long as they can, but as, like you said, as healthy as they can, because if you're going to make someone look beautiful, you want them to enjoy it. Now, one of the things that really kind of caught my attention, because I've heard a lot of people with this problem, is long COVID. So a lot of people are like, oh my God, I have long COVID, nothing helps. Well, there are a few scientific articles that say by doing therapeutic plasma exchange, that the symptoms of long COVID either go away or decrease significantly. Now, it's just common sense, right? We're taking all of these immune complexes that are stuck in your plasma and just getting rid of them. And by doing that, I think, like you said, you mount a much better response to what is bothering you, and hopefully get rid of those triggers. Something that we're actually treating people with long COVID in the office. I think it's something that can be done that is, again, the beauty of this is the downside is just 2 needles. It really is. There are no real long-term side effects or short-term side effects, except for the fact that you have to sit for a couple hours and have this done. Correct? I mean, really, there's nothing to worry about if you're in a place that's doing this like ours and knows what we're doing. We have the best machine there is, and we're replacing it with albumin, which I think is much better than putting in like a saline or lactated Rinker's solution to replace it.
It definitely is. I mean, look, you literally sit in a massage chair. You have 1 to 2 IVs that are placed. And the reason why we choose one versus other, some people just don't have great veins, and so you have to do, and it takes a little longer because one IV has to not only pull blood out, but put cells back in. And so that's why it takes a little longer. But usually when you have 2 IVs, you can clear an entire blood volume within 2 hours, sometimes even a little less. You sit there, ultimately the albumin goes back in as the plasma is being taken out. You have really no major fluid shifts because the consistency of the albumin is very similar to plasma. And afterwards, minimal, if any, side effects, meaning, so you'll have some redness from the infusion sites, just from the needles. But otherwise, I didn't feel tired. I didn't feel thirsty or any of those things that I thought that I would, right?
The hardest part is just sitting still for a few hours.
Yes.
For someone like me.
As far as who's a candidate, I would say, people in their 30s that have a genetic predisposition to having lipid dysfunction, high cholesterol, high triglycerides, things like that, I definitely would start early because you will dramatically reduce the potential for cardiovascular disease and having a heart attack. For those who have autoimmune disorders, I mean, this used to treat a lot of autoimmune conditions. And so there's more and more research showing that it's removing some of these autoimmune complexes. And the great part about that is sometimes people it puts your disease in remission, right? We have all of these different new medicines that suppress the immune system, especially plaque psoriasis. I mean, that's one of the most common things because people say, oh my gosh, you can see it now on my skin. So it's become, a multi-billion-dollar industry. But if you can keep that at bay just by clearing out some of these autoimmune complexes, you may not have to take these medicines that blunt your own immune system.
Now, I know that there is one further step that we can take after we do this that is even a bigger boost, or really to make you superhuman in a sense. What is that? So I come in your office, I really have no ailments. I just am here for anti-aging and wellness, right?
Yeah.
I'm not looking for anything. I'm doing well. I am a 50-year-old man, but I want to live as long as I possibly can. Sure. What's the next step after TPE that can even give me that bigger boost?
Yeah, look, I think TPE is a prime setup to get your body into good fighting shape, right? It essentially is clearing a bunch of toxins. So if you were to choose any other treatments, such as regenerative treatments, it would put your best foot forward. Then you can head down to Mexico or Panama or Costa Rica. We have our own longevity center in Cabo San Lucas called Proactive Longevity, and you can undergo what's called an NK cell preparation. And what that does is your body has these natural circulating natural killer cells. And so if you do develop a bacteria or a virus or something like that, or cellular senescence, your aging cells, these NK cells destroy these what are called zombie cells, right? They're non-functioning.
Sometimes can even lead to cancer.
Yes. And so what happens is the NK prep will clear out some of those aging or senescent cells. And then you follow it up a few days later with stem cell therapy and exosome therapy. I mean, these are regenerative treatments where now you are putting in the building blocks. So let's say you've cleared out the toxins, you've cleared out the aging cells, and now you are putting in fresh, healthy, new cells from either umbilical cord tissue or placental-derived or adipose-derived, which really can differentiate into multiple different tissue types. And so the idea is when you clear out all the things that are preventing your body from healing itself, now you add the building blocks for that, you can start regenerating tissue, joints, things like that. We have amazing stories of people whose eyesight get better. We have amazing stories of people whose gray hair turns brown. We have amazing stories of people whose aches, pains, and joints feel better, that your sexual function increases, that your sleep patterns are greatly improved. And so that would be the next step. So
again, I think filtering everything out and putting in new, healthier, younger cells. So very similar to the parabiosis study, but it's a little different because we're clearing things out and we're not hooking up direct blood flow from one to the other, but it's very similar, and it does work, and it is the next step in longevity. And if you hear these biohackers from Dave Asprey to Hyman to all the guys that are changing, the trajectory of aging, a lot of them, first of all, they all believe in TPE to another level. They've
Definitely.
all done it. They say this is probably the best way to do it without having to take 500 different pills and supplements and all this other stuff. This works because you actually see it with your own eyes.
You're right. It's interesting for people who have high triglycerides and have an elevated LPA or ApoB, you can see that the plasma is a little cloudier. It looks like almost like milk.
Yeah.
Whereas someone who's very healthy, you can see a very clear yellowish plasma, right? And so it's such a game changer for those individuals. And so even if you chose not to do any further type of treatment or testing, this is definitely something that can lead to longevity and reduced inflammation. So something I definitely, I wholeheartedly agree with. I think with the growing body of evidence showing its potential benefits, not even potential, showing its benefits of increasing health span, I think this is a no-brainer. And for us, this is an extension of our aesthetic surgery, right? Because if the inside doesn't match the outside, again, our results obviously will not last as long. And so we want to create the best possible solution. So, we can keep you looking and feeling younger.
And the interesting part about all this is it's, first of all, no hocus pocus because you actually see it. Because a lot of things that nowadays they say, take this and you're going to feel better or do this. This is real evidence-based medicine. There are scientific articles. There's a lot of research being done towards this. The other thing is that we obtain a series of labs and biomarkers from every single person that comes through this door that gets this done. And it's our way of showing, look, by doing this, look at what's going on. And to me, the proof's in the pudding, right? If I can see that, hey, if I do this and like if, for example, lift weights and my muscles get bigger, then I'm going to keep doing them. But if I am getting therapeutic plasma exchange and it's not doing anything to my biomarkers, then it's a waste of time.
Sure.
But there's so much research behind it showing that it helps, that it is a definite mainstay in this field. Now, our good friend Darshan Shah, who owns Next Health, added it. He's probably the first guy to do it, and we're probably the second in all of Los Angeles. There's not that many places that are doing it yet because it is something that needs to be done by qualified professionals with a very expensive, probably one of the coolest machines in the entire world that we have here in our office, and we do it right there. So simple, easy. I think it can apply for just about anyone, probably above the age of 30. And as long as you're in good cardiovascular health and you don't really have too many other comorbidities, if you're super sick, this is not for you. If you're relatively healthy but want some things changed, have some inflammation, have higher biomarkers that you want to get, lowered, I think this is the treatment for you. I think it's something you should really look into. We do it here. Obviously, you can reach out to us or other places if you're not in the Los Angeles area. And I think this is something that over the next 5 to 10 years, you'll see it's going to become
an explosion.
Yes,
sure.
Absolutely.
Yep. If you like this video, you're going to love this one.
20% of your brain might have damaged brain cells. They're just not working as well as they have. Maybe they're working at 10%, 40%, 50%, right? Sure. What if we can recover those 20% brain cells and bring them back to 100? You're going to be smarter. You're going to have more energy. You have more mitochondrial function. All those things are going to go up. And you can do that with things like